Good afternoon. I'm George Latimer, Westchester County Executive. It's Thursday, May 5th, and we're here for an important recognition that the month of May is National Mental Health Awareness Month all across the United States. And here in Westchester County, we're recognizing that with a series of activities and to share with you some of the programs and services that are underway. It is also the week that we're in, Children's Mental Health Awareness Week. And that period of time extends until May 7th. So in both of those two cases, there's an awareness of issues that are very important to us, the well-being of our individuals, childhood well-being, and we have many different forums and activities which we'll report on in this conversation. Our mental health and wellness is really more relevant today, given the fact that we are in we hope, the latter stages of the COVID-19 pandemic. The period of time over the last 2 years is unprecedented for any of us who are alive, and we've seen a series of issues that have affected all of us as a society. The grief, the loss, the perception of the actual increase in anxiety, the sense of despair and depression that have all been generated by a different way of us interacting with each other, a reduced way of us interacting with each other, and systems that we rely on not being there to help us provide that balance. There are disorders, mental health, and alcohol, substance abuse, misuse, that has affected those of us and has been a major focus of our county efforts to address to that. We want to turn the conversation toward wellness and resilience and to try to help find those programs and services that will help our population be able to deal with that. There is a new grant that we're very proud to receive. I'm sure our Commissioner Michael Orth will be one of our speakers. We'll talk about it, that we received from the New York State Office of Mental Health to support our efforts in serving children and their families. And as part of this grant, we're creating a children's cabinet in our county, which we'll talk more about with our various speakers. I think it's the most important thing is to appreciate that there has been historically a stigma attached to mental health wellness. And that stigma needs to be lifted. We need to be able to have an honest conversation. We need to be able to discuss mental health is a health issue. It's not a statement of a person's intrinsic wealth or intrinsic value to the society. And as best as we can make those efforts forward, we have some terrific professionals who are part of our organization who will be speaking with you. I'll introduce them individually, but in sequence, I'm going to ask Michael Orth, our Commissioner for the Department of Community Mental Health, to speak on this. We have with us John Befus, who is the first Deputy Commissioner for the Department of Social Services. We have Dr. Damia Harris-Madden, who's the Executive Director of our County Youth Bureau. The Honorable Jewel Williams-Johnson, who's Westchester County Legislator, and Sarah Nabi, who's a sophomore at Hendrick Hudson High School, and she will discuss the importance of the youth voices and building awareness. So first, let me invite our Commissioner for the Department of Community Mental Health, Michael Orth, to join us here at the podium. Commissioner.
Thank you.
Thank you.
Good afternoon. I'm excited to recognize May as National Mental Health Awareness Month and Children's Mental Health Week. Let me begin by expressing my sincere gratitude to our County Executive Latimer, Deputy County Executive Jenkins, and the Board of Legislators for their support and leadership as we help our residents with mental health wellness. Under their leadership, the department has been able to provide support to all residents in need, from early childhood mental health services to outreach programs for residents with complex behavioral health issues, and our newly created Project Alliance, which includes a 911 dispatch diversion, police behavioral health crisis line, and mobile crisis teams throughout Westchester County. These and many other services. Thank you. Throughout the month of May, we recognize the opportunity to promote mental health and, as a county executive, mental wellness, and the importance of early intervention and access to effective treatment. This also includes addressing co-occurring disorders. As we know, there's also a relationship between mental health and self-medication and individuals who struggle with alcohol, substance abuse, and end up experiencing mental health challenges. As Commissioner of the Department of Community Mental Health, I have witnessed the impact of the pandemic on the mental health of our residents over the past 2 years plus. Yet, as we know, this is a crisis that preceded the pandemic. The pandemic further exposed how important our mental health is and connected to our physical health, and how our mental health can be impacted by biological, psychological, and social factors, as well as traumatic experiences, which of course may include the pandemic, loss, violence, war, or other social and racial injustices. The past 2 years has further exposed the lack of access of services, disparities in our health system, and lack of parity in behavioral health insurance. These are all national issues that must become a greater priority in our country. Yesterday, I was fortunate to participate in a viral forum with our Surgeon General presented. In addition to the need for greater access, he also spoke about the importance of building mental health in our public structures. Building mental health in our public structures. This includes the natural settings where people go as schools, businesses, places of worship, and community center. His comments validated exactly what we're doing here in Westchester County and in our local communities. And I stand here today on behalf of the many champions doing this important work. And let me share a few of them. In our schools, we're providing mental health and teen first aid, thanks to agencies like WJCS and other trainers. Our schools are trying to implement social emotional learning for all students. Our faith-based leaders, Reverend Trollinger, Reverend Switten, Rabbi Alfredo, and Pat White, have introduced soul shop training to over 150 faith-based leaders and spiritual leaders throughout Westchester counties. In our communities, Nabi, Westchester, you can see the bus line, May is Mental Health Month, really spreading the word of mental health. In our diverse communities, efforts such as Que Pasa Latinx in Yonkers, led by Maria Alfaro, and the African American Men of Westchester, led by Edwin Bowen and Hassan Bile, are doing a special mental health presentation for the month of May. In government, yes, our own Westchester County, we're proud that we're the first of 3 pilots across the country that piloted mental health first aid at work. This was provided to county staff on the importance of mental health and mental wellness. And finally, and most importantly, the young people that are truly driving the conversation. We have Stephanie Marcazzano leading the CODA efforts in schools, Jessica Grimm with the Brave Hearts, and in a few minutes, you will hear from a rising superstar. These are the programs and individuals that are making a difference and changing the dialogue on mental health, substance misuse, and co-occurring disorder. We encourage all of you to get involved and help make the difference. As the county executive mentioned, there are many other activities, and I'll highlight a few. Thanks to our communications department and Department of Parks and Rec at the county center, you'll see the electric banner supporting mental health awareness. NAMI of Westchester is holding their annual walk at Ridge Road Park on May 14th. For the faith-based community, we're doing the Soul Shop training, May 16th and 19th. And we're also doing mental health first aid training for veterans and military members and families on May 14th. We encourage folks to join these events and also look forward to working with the local communities to engage as well. Today, I'm excited, as the county executive said, to share that Westchester County was recently awarded a grant from the New York State Office of Mental Health through the Substance and Mental Health Services Initiative to strengthen our children's system of care efforts by forming a children's cabinet. Westchester County's system of care has a rich history and a national reputation of excellence dating back to Myra Alfreds, our former director, who created the first child and family community network in Mount Vernon. And not only did it start in Mount Vernon, but 2 of our leaders here, Dr. Damian Harris-Madden, worked in Mount Vernon, and our county executive is, of course, from Mount Vernon. So a lot of good things originate from Mount Vernon. And since that time, we've expanded to 9 community networks throughout Westchester County. This is a local planning body that comes together monthly to make sure that we're meeting the needs of young people in our communities. The community networks are also connected to our county planning committee to ensure coordination between county and local stakeholders. And this is a message that has been reinforced by our county executive, the importance of communicating with our local communities. The Children's Cabinet, which was the recommendation of Department of Social Services First Deputy Commissioner John Befus, and is based on a model from the National Governors Association, will consist of county departments and key stakeholders charged with strengthening collaboration between the various child-serving systems. This will be accomplished by using a strategic framework to better share data, promote best practices, and identify gaps in meeting the needs of children and families in our county. I would like to thank my colleagues from the county departments for their leadership, their commitment to this newly formed Children's Cabinet. Commissioner Posey from Probation, Dr. Shalita Amler from the Health Department, Commissioner Towns from Department of Social Services, Commissioner Gleason from Public Safety, our own Director of Youth Bureau, Dr. Damian Harris-Madden, Director of Office for Women, Robbie Schlaff, our District Attorney, Mimi Roca, and of course, our County Executive's Office. And finally, I would like to acknowledge Tori Shaw from our Department of Community Mental Health, who led the effort in both writing the grant successfully and organizing the cabinet. Thank you, Tori. I'm proud to be here today with my fellow co-chairs of our steering committee to share more about our efforts. And finally, in closing, I'd like to take this opportunity, May being Mental Health Awareness Month, to acknowledge the efforts of our staff at Department of Community Mental Health for their their commitment, not just during the Mental Health Awareness Month, but throughout the year. You are all making a positive difference in the lives of so many. Thank you.
Thank you, Michael. That's Michael Orth, our Commissioner of the Department of Community Mental Health. And as he pointed out, this is a collaborative effort across a number of different portions of our administration with the cooperation as well of the Board of Legislators, and you're going to hear from Jewel Williams-Johnson in a few minutes. But next I'd like to ask the first Deputy Commissioner of our Department of Social Services, John Befus, to join us. He is here along with Commissioner Leonard Towns, and Deputy Commissioner, please join us here and share the work as it relates to the Department of Social Services.
Thank you, sir. Good afternoon, everybody, and thank you for having me. Thank you, County Executive Latimer, for this opportunity. My name is John Befus, and I'm the first Deputy Commissioner of the Westchester County Department of Social Services. And I'm here along with my Commissioner, Leonard Towns, and Deputy Commissioner Derek Hines, who are both with us today. We're honored to join you, Commissioner Orth, and all of you, Director Harris-Madden, in recognizing Mental Health Awareness Month. And we look forward to our continued partnership and commitment to continuing to work together on behalf of children, youth, and families in Westchester County. Safety, permanency, and well-being have always been the foundation of our work, going back more than 15 years in child welfare, and none of these can be accomplished without recognizing that wellness, including mental health, is critical to healthy child, youth, and family development. This led many years ago, more than 10 years ago, to the creation of a Westchester County Cross-Systems Unit, where we collaborate together daily, side by side, with our mental health department, probation, more recently Youth Bureau, and other community partners to serve children throughout and their families throughout the county. This, along with federal legislation, led to a family-first focus with an emphasis on prevention, family-based services, and reduced institutional care. So compared to 2008, when 929 children were in foster care, on March 31st of this year, 334 children were in foster care, meaning nearly 600 children are able to safely remain in their homes with supportive preventive services. And now, with the creation of the Children's Cabinet, thanks to the County Executive, Commissioner Orth, and the entire team, which has been championed at both the state and local level, as Commissioner Orth shared, we have the opportunity to further advance these goals with a focus on a few things, as were mentioned. Senior level commissioners and decision makers at the table serving children, youth, and families. Collaborative department governments and coordination of programs and services to avoid duplication and maximize what's available. Increased efficiency in mobilizing resources, and implementing a shared vision for Westchester's children, youth, and families through measurable goals, outcomes, and data tracking. And last but not least, utilizing existing county child and family groups in a formal advisory capacity so that we're all working together on behalf of children and families. So thank you again for this opportunity, and we look forward to continuing the good work, and I'll turn it back to the County Executive. Thank you, sir.
Thank you very much, John Befus, who is our first Deputy Commissioner of the Department of Social Services. One of the first people that was brought into the administration over 4 years ago is our next speaker, Dr. Damia Harris-Madden, who serves as our Executive Director of the Youth Bureau. She has really revolutionized our programs, worked cooperatively with municipal programs, which she headed one previously in the city of Mount Vernon. And she is a real star within our administration, and we're very honored to have her here, and certainly as a contributing member of this effort. Dr. Harris-Madden.
Thank you, George. I am truly honored to be here, and as always, so appreciative of those descriptors that the county executive uses. I don't know if I meet that challenge or not, but I will say that it has been an absolute pleasure working with within this administration, and I feel extremely valued, and I'm here today with Susan Weissman of the Westchester County Youth Bureau team, and we collectively feel extremely supported in the work that we're doing for children, youth, and families. The creation of the Children's Cabinet really came out of, the brain trust that we have here in this administration between Commissioner Orth, Commissioner Befus, Tori Shaw, and others. We sat down and talked about how can we synchronize the work that we're doing. And so, there's complete alignment when it comes to the needs of our young people, our residents, and this cabinet truly underscores the alignment of standards and our intentions across all departments to service children, youth, and families who have challenges that interfere with their daily quality of life, the deep commitment to understanding and advancing the principles of prevention. As leaders, parents, practitioners, neighbors, we generally understand the struggles of maturation. This is normal. Struggling with emotions and behavior is a part of the transition from childhood to adulthood. Yet, for some children, the conditions and the places where they live, learn, and play can cause undue stress, and we've talked about the pandemic. We've talked about the negative consequences when it comes to substance abuse, alcohol use, and we also understand that there are children that are suffering in silence. As a parent, I'm going off script to say that I have children that also suffer from these challenges because of the daily pressures, whether it's my high schooler who is in science research, trying to juggle sports, trying to maintain her A average, and the anxiety that is evoked in her because she is charged to rise above. Or if we're talking about my middle child who is suffering from prolonged grief due to the number of tragedies and unfortunate losses we've had in our families. Mental health challenges should not be a stigma. So I'm so pleased and delighted that throughout this month, our administration is highlighting and underscoring the necessity to synchronize our resources, ensure that we are deploying them in the correct manner, and we are addressing the gaps that exist. Now back to script. We've understand that mental health is equally as important as physical health. And to that extent, the conversations that we've had throughout the past years leading up to this grant surrounding health, we understand that there must be more campaigns and messaging to promote the prevention, just like we did with tobacco, just like we've done with substance use, addressing the dangers of obesity. We must promote messaging that demonstrates that we are concerned and we recognize that suicide prevention is equally as important. Suicidal ideation is equally important. Grief, loss, anxiety, and depression equally as important, particularly for our children and youth. As a cabinet of individuals, we want to maximize the natural resources that we have, and Westchester has an abundance of resources. As a matter of fact, this administration has made sure that we have additional resources for the many nonprofits, some of which Michael has named, that we all work with and know have been effective in serving our young people, children, and adults. As a cabinet, we want to address the gaps. We want to look at the social determinants of mental health, not just health. We often hear about the social determinants of health. Well, I would submit that we add mental health to that paradigm. So while we develop participatory research through assessing, through needs assessments, Commissioner Orth, myself through the Youth Bureau, hopefully DSS, we will all be looking at ways in which we can assess so that we can make informed decisions about the way in which we deploy our resources. And we would be remiss if we did not talk about the disproportionality within certain communities. We know that those living in different circumstances have different sets of challenges. Off script, coming from the city of Mount Vernon, I know all too well when you do have neighborhoods that have, some overcrowding, when there are circumstances of loss and economic challenge, what those burdens do to parents, and therefore the ripple effect onto children. So what we ask of our communities is to collect and use mental health indicators and data and help us, because we don't purport to know it all. please help us and join our cabinet once it's opened up. We want to work with our families and healthcare professionals so that our families are better equipped, our professionals are constantly being trained and upgraded in terms of their knowledge so that they're better equipped. And we're also seeking the support of the community so that they can identify, like Stephanie Marcasano does, with the children that are experiencing these challenges, but also identifying and connecting them to resources. And we want to make sure that we diagnose and treat these challenges, because I believe it was Dr. Amler who stated, even back when she was in medical school, there has always been a dearth of professionals that are addressing mental health. And so now is the time that we seize the opportunity and we take advantage of this funding. So with that said, I want to say thank you for allowing me to share today.
Thank you very much. That's Dr. Damia Harris-Madden, who is Executive Director of our Youth Bureau. I mentioned briefly a second ago that you've seen different representatives of the administration, different departments of the administration, but these things are a partnership. They're a partnership between the legislative branch of government and the executive branch of government. And Jewel Williams-Johnson, who is a member of the Board of Legislators, new member of the Board of Legislators, has taken on as a priority these issues within her committee responsibilities, and as a legislator who represents Sleepy Hollow, Elmsford, sections of Greenburgh, including Fairview, and also a section of the city of White Plains. And she has shown, in just a very short period of time, leadership on the legislative side of these issues. So I'd like Legislator Williams-Johnson to join us. Thank you, Jewel.
Thank you, George. Really appreciate being included in recognizing this month. Because it provides a reminder for all of us of just how essential mental health is to our overall health. It's also a good nudge for us to be cognizant of all of our community members, especially those living with mental health issues. It's a nudge to remember that they are more than deserving of care, of understanding, of compassion, and pathways to hope, healing, recovery, and fulfillment. It's what we all need and deserve, especially now more than ever as we transition out of pandemic, hopefully, to endemic. We need and deserve it not only for ourselves, but also for our loved ones, for our communities, for our nation, and as a global community. To raise mental health awareness, it helps and informs to understand symptoms, find professional treatment, and most importantly, break the mental health stigma that leaves so many people suffering in secret. Our county is particularly fortunate to have such dedicated and mission-driven leadership in both our county executive, George Latimer, our deputy county executive, Ken Jenkins, our commissioners, Commissioner Orth, Commissioner Amler, Commissioner Towns, and our wonderful executive director, Dr. Harris-Madden. As chair of the Board of Legislators Committee on Health, I more than appreciate their leadership, their expertise, and their overwhelming willingness and assistance as our committee plows through a very huge agenda with a priority on mental health and heightened importance for support of mental health programs, resources, and services. I'm being brief because I'm excited to hear from our next presenter. Thank you.
Thank you. That's Legislator Jewel Williams-Johnson, and a healthcare professional by profession, and the leader on the Board of Legislators in matters of health, and we thank her for her leadership. Our last speaker may in some ways be the most interesting and important speaker, sophomore at Hendrick Hudson High School, and discussion is ahead of Youth Voice and Building Awareness, Sarah Nabi.
Hello everyone, my name is Sarah, and I just recently started to get involved with mental health awareness and education. I started No Stigma, an event dedicated to teen mental health awareness. Our first ever event was actually last weekend on May 1st. We had a keynote speaker, psychologist, and health coach on board, and they all helped me in beginning what is hopefully a series of events just like these. The goal of my event, and hopefully the The goal of my event of No Stigma is to educate myself and others on how to understand mental illness and mental health. So this raises the question of how I got involved with mental health advocacy. Since I was little, my mom would mention her grandfather, who fought in World War I and was awarded a Victoria Cross during the time he served. I was always amazed by his story, and later, I learned that he had died by taking his own life. Now that we know more about mental illness, we knew it was due to severe post-traumatic stress disorder. His death left my mom's father, my grandfather, without a father, and his death had a ripple effect on their family. It even affected my mom, who grew up without a grandfather and saw the struggle her father had to go through dealing with his father's death even years and years later. Though I never met my great-grandfather, his story always stuck with me. What I took away from it was that because there was no knowledge about mental illness and PTSD, my great-grandfather was left unsupported and unable to cope with his trauma. Then, many years later, came COVID. I don't think anyone did well mentally during COVID, and if someone told me they did, I don't know if I would believe them. I personally struggled a lot, and I suppose we were all hanging off the edge of what was, afraid to really jump into and face the uncertainty of the future. There was so much confusion, and of course, people's main goal was to remain healthy. But the catch is, in the efforts made to preserve physical health, mental health was abandoned. While this is nobody's fault in particular, it still had such an effect on everyone, the people around me, adults, children, of all ages. I saw as my friends' and peers' mental health was left behind to maintain physical health and to just keep up with everything that was going on around us. It was during all of this that I remembered my great-grandfather, and I remember thinking, oh my God, there is a worst-case scenario here. If things are bad now, what will happen if things get worse, if people are left without support? When people my age struggle, be it with depression or anxiousness or coping with trauma, if they don't want to reach out or don't understand what exactly is going on, there's no getting better, especially without support. I want to avoid what happened to my great-grandfather by starting conversations that weren't started then and now due to societal stigma. Hopefully, people may be equipped with the tools to better understand themselves and what they are going through. Thankfully, in my home, there was a space to talk about whatever I was feeling, and with that came change. If a child can't even feel safe enough to verbalize their emotions, then no one gets better at all. And I've had people ask me, why are you doing this? Why do I even care? What's the point? And if after enough people ask, you start getting that little bit of doubt. And it creeps in, like, what's my motivation here? What if I do all this work and there's nothing to show for it? And you know what? I found an answer, because this isn't just me. This isn't just you. This is us, and this is we. This is our collective mental well-being as a whole, because when there's enough stigma and enough lack of awareness, enough lack of education, everybody suffers. Everybody. No one can do this on their own, especially not children and teenagers. This is why it is so important to have conversations like this one and to raise awareness just like we're doing here. It is so important to teach and to learn because this is a we problem, so to speak. And as a result, we all need to work together to make sure it's nobody's problem. I would like to just say thank you for inviting me here and for creating a space where discussions can be had, because it is discussions like these that influence change.
Thank you very much, Sarah. Sarah Nabi, a sophomore at Hendrick Hudson High School, is very powerful, and we value the words that you shared with us today, equally as valuable as our other speakers with us today. I had the opportunity just before being here for this conference to speak at a community organization on the Sound Shore. And after a presentation, we opened it up to questions, and we got questions on a wide range of public policy issues. And you begin to realize that in the area of mental health and mental wellness and the efforts that we need to make, we must take this issue and prioritize it, because it tends to be pushed to the background in almost every other setting. Over the course of this week, we have been at this podium to talk about the Airport Master Plan. We've talked about our police reform implementation efforts. In our weekly update, we talked about COVID. We talked about an issue in the Corrections Department. We also talked about our coming suspension of bus fares and reduction in gas tax, sales tax. We've had meetings in these offices over the last few days to talk about our bus routes, our EMS crisis. We've talked about a fire tower in the northern part of Westchester, right to counsel legislation. We've had our Salute to Seniors event this week that begins a month-long activity, and the household cleanup program that's coming up this weekend in Yonkers. Covered a lot of things. And if we don't prioritize mental health issues, then they will continue to stay in the background. They'll continue to stay as the unspoken area of health that nobody mentions, with that stigma attached. But I think, as you see from Sarah's conversation, which is very powerful, and then the work of each of our professionals, we're not going to let it sit in the corner. We're not going to take it as just one of any number of issues, but as a central issue. It's an issue that has not gotten the proper attention, but with professionals as the ones you've seen here, the resources we have that we've allocated, the resources we get from grant programs, we're going to do our very best to try to address them within our capacity and power as a county government, with the partners that we have in local government and even more importantly at the state level. But I want to thank again all of our speakers today, Commissioner Michael Orth, Deputy Commissioner John Befus, our Executive Director, Dr. Damien Harris-Madden, Jewel William Johnson's legislator, and particularly Sarah Nabi for her testimony. We hope that you see that this declaration of Mental Health Awareness Month is not just a declaration. It's not just a proclamation. It's not something to say on a Thursday and then we say something different on a Friday, but that we intend to create a response that is effective to deal with this issue in our society in the same way that we deal with as many issues as come before us as your county government leaders. I'm George Latimer, Westchester County Executive. Thanks for watching. Have a good day, and we'll speak to you again soon.